So this is part 2 of today's talk series, and I'm kind of incredibly honoured to have Monique Simmonds here, who is kind of one of the most sort of interesting and I don't know, political and social kind of informants on my mind over the last couple of years whilst developing this project, and the work she has done with the innovation unit at Kew Gardens and the Millennium Seed Bank has provided us with a wealth of information that could have been lost easily. And yeah, it's a real honor to have you here today.
Thank you.
So I'll hand over to Monique.
Thank you, and really representing here different aspects of work at the Royal Botanic Gardens, Kew, on medicinal plants that we've been undertaking over the last, say, 30 years, especially on my side, and the development down at Wakehurst Place with the Seed Conservation Department there of the Millennium Seed Bank, which is the opportunity of saving seeds from around the world that are actually very important to mankind, that are used by people, that sometimes those that often get overlooked. And that's the wild relatives of crop plants, but also our medicinal plants. But I'd like to tell you about some of the stories that I've had, and then come back really to UK plants. I mean, I've been working in this area for the over 30 years, let's just say. Different parts of the world, about 80 different countries actually, finding out about plants. I'm not a botanist. I'm actually an entomologist stroke neurobiologist that got involved in plants and came to Kew because Arthur Bell, who was one of the directors back in 1983, was working on Parkinson's disease. And we were doing some work on some plants that possibly could have some cures. And he was interested to see if we could develop this type of work and understanding the medicinal plants at Kew. And so I came and joined the team at Kew and really haven't found anywhere else to go since that has provided kind of the resources, the freedom to be able to go and investigate in different countries, etc. And it's been a fascinating career. So the more I've kind of worked with plants, the more I find that I think I know more, but actually I think I learn less as time goes on. And that is really understanding how medicinal plants have evolved, how they've been selected by people. We really don't understand that. Why did somebody over the years select one plant and not another's? For example, some of the work that we did with other colleagues at Kew, that was William Milligan, who's an ethnobotanist who did work with the Yanomami Indians in parts of Brazil. He was interested in the uses of plants for treating malaria, and he collected 128 species from the Yanomami Indians were using, and he brought some of those to Kew with the idea that we would actually, along with the London School of Tropical Medicine, evaluate their activity. Now, 68 of those plants had really potent activity in screens. So there was a justification for going further. And some of that work was done at Kew, and again, some of it was done quite correctly in Brazil because the plants came from Brazil. So the project went on, we moved on to other things. One of those plants was a Plactanthanthus, which is a member of the herb family related to your salvias, your thymes, etc. And it's a group of plants that are used frequently for medicines in parts of Africa. And we were doing a survey of this genus and its particular uses in Africa. And lo and behold, one of those plants that was used for treating malaria was the same as had been used by the Yanomami Indians. Now the twist to this is the plant is more indigenous to Africa, not South America. So how did a plant in Africa get used by the Yamahami Indians for treating fevers, because of course the perception possibly wasn't malaria, it would have been treating fevers. So this is where you start to go into kind of a detective story into how possibly could have it been transferred and used. We think it was taken by the Portuguese as part of their planta medica, their medicines. It was then adopted for cure for fevers, possibly by the Yamahami, because it was better than something else that was locally used. Because people, will select. Basically, if something's going to be used continually, usually has to have some activity. The other thing about it, it was never used by itself. It was always used in combination with other plants. And I think that's something that we're learning far more about. Is you go back and you look at the history of plants. It's very different from our magic bullet approach, where you take, one medicine. It's often a combination of plants that are used, and I think this really comes to the fore when you look at traditional Chinese medicines, when it's at least about 5, if not 12, 13, 14 different plants that are used together. That kind of composition is important. But even if you're taking one plant, you're going to have a cocktail of compounds in that plant that are most likely going to be associated with a medicinal property. And I think there are challenges. I'm a scientist, so I'm interested in understanding how these plants actually work. And the challenge is that we often try and make extracts from that plant to identify what the actives are. And we're doing it in artificial situations. We've got a cell-based assay. We're not mimicking what happens in the body. You make an infusion, you drink it, it's then absorbed by your gut and it's transferred then to the parts of the body where the receptors are, the targets for your ailments. So it's most likely affecting your immune system, anti-inflammatory, antioxidant, due to that combination of compounds that are in that plant. And what we're often doing is artificially separating that. And it's not surprising, therefore, that I think it's very difficult at times to repeat and explain exactly how a medicinal plant works. But again, we try to. Why do we try to? Because in a way, if you're trying to get something regulated, you have to explain how it works. And that's a challenge that we have when we're trying to move from a traditional use of a plant to getting it through the regulations so that it can be standardized and therefore available, say, to the general public by a product that you can buy, rather than being given, say, by herbalists as a infusion that they make and therefore they can treat their patients. Now, why is this possibly important? Well, I think it is because there's less of a knowledge about many plants compared to possibly some years ago. There's often a breakdown in that link between plants, or your environment and your ailments, and therefore the selection of plants. And if you talk to a doctor, take doctor 200 years ago, they most likely would have been using medicinal plants. That would have been the main form of medicines. But how many of our doctors now have got any training in botany or in the use of plants? Very few of them. There's an increasing interest, and that is led by the demand of the interest in herbal remedies. Complementary therapies is really coming to the fore. And going back to something you were saying about the traditional Chinese medicines, I think we've got a lot to learn from their use, because they use modern medicines as well as herbs in many of their hospitals. They're trained for about 7 years, though, to be able to do this combinations. And you very rarely in China would find somebody giving you a traditional herbal combination unless they're fully trained. It's not always the case here. When something goes wrong in the UK, has occurred a few years ago with traditional Chinese medicine. It was the case of aristolochic acid toxicity, and you've got renal failure. So it's a case when something went wrong, it was a confusion. Somebody mixed the plants up. The result of that, when 3 patients died in the UK of renal failure, was the banning of a group of plants. But the headlines were toxicity associated with Chinese medicines, which going to put the whole of the traditional Chinese medicine as if they were bad. And then it goes and percolates out to other European medicines. So I think there is a case for a better understanding and some form of regulation, especially if it is going to be sold as a product. Because I think people need to know that they actually are getting something that's quality, that we have looked at, as Michael was saying earlier, about contamination of the soil, etc., that we do know that there are no pesticides in that material, no contamination with heavy pollutants, because of course our environment is polluted, and plants are very good actually at taking up, unfortunately, accumulating and taking up some of those pollutants. So we need to make sure that the material that we are using in complementary therapies is good quality. So just give you then a few examples of some of the work that I've been involved with other communities abroad. And one that really had a huge impact on me is work we were doing in South Africa. And that was just out with some communities outside Grahamstown. This was with a UK-based charity called Garden Africa, as well as a South African NGO called Umtati. Now, we were invited to come into the project to assist them with the propagation of the plants that they were wanting to treat their communities with. And this is an area where you've got high level of communities that really rely on plants for their primary source of medicines. They don't have the funds to be able to buy the westernized drugs to treat conditions like related to HIV. They rely on their plants. But there had been a change in land use in the area with the increase of big game farms. So the traditional healers weren't really able to collect their plants as easy as they had in the past. Game reserves and going out and collecting plants don't always go together. You've got lions and other things in those areas. So they were wanting to propagate the plants. Now, they were very reluctant to tell us anything about the uses of those plants. Fair enough. Our role was to help propagate. And so we managed to get them an area of land that they could grow the plants in. And this is where kind of a scientifically based project, because we had to get funds for this, and we managed to get some from DEFRA as a Darwin Initiative grant, and also we've been able to get some funds from the EU. And that was to be able to purchase the land and for the training for some of the staff that we needed to have to help grow the material. Identified the plants, started to grow them, and then the traditional healers said, "Wait, stop, can you just stop please? We need to bring the spirits with the plants." Okay. This is where you need really a group of people to help sometimes on these projects. As a scientist, thinking, okay, how do you bring the spirits with the plants? And they said, well, one of the things is to bless the land. And you're kind of thinking, well, how many times when we move house do we actually, bless the house and things like that? So kind of pretty obvious things. So we went through a ceremony, and there was the blessing of the land, and then they sung some stories about the uses of the plants, kind of to bless some of the plants that they were using. But then they kind of went, no, we need to do more than that. Okay, fine, what else do we need? We need to bring the spirits with the plants. How do we do that? Well, let's take some of the plants and just see if they're going to grow in that soil. And so we took a number of plants that they had selected, We kept some of them in the area that they were growing. We took a sub-sample of that and we just transferred it to the land that we purchased. And then we took another sub-sample and we took the soil with the plants and we grow them. We got the permission from the healers. In fact, they helped us make some extracts of the plants so that we could study the chemistry of the plants, so we could get kind of like a chemical fingerprint to see. The idea here was to see if that chemical fingerprint, therefore the medicinal properties, because of course it's going to be the compounds in the plant that are going to be associated with the activity, are they going to be different? We then did the experiment, and out of the plants that we looked at, 6 of those were incredibly different if we just planted them in the soil. We needed to make sure the nutrients were the same as the soil that they've been grown in. One of the key things in some of those plants was actually the mycorrhizae fungi that were associated with those plants in their natural habitat. It was a learning curve, and I think it's a mistake that we've actually often made. When we have identified a plant that is being used by a community, especially if it's gone in as a scientific project, you've identified it, you've taken it out, and then you start to look at it. A scientist comes along, or even a community comes along and says, actually that plant is not working as well. It's because we haven't taken enough care in actually selecting the plants. Now there's some other examples. We don't need to go to South Africa on that. And, that gives a more recent example. Now, most of my career I've actually worked on plants in different parts of the world. So back to the Millennium Seed Bank project, the first goal of the Millennium Seed Bank project was actually to collect the seeds from the UK flora. Now traditionally, we actually haven't done much work on the UK flora. So with a remit for the Millennium Seed Bank to collect seeds, we thought, what else can we do on the British flora? There's 2 things really happened. One, we got involved in the Ethnomedica project, which is a remembered remedies project, which is now partly coordinated out of Kew, and you're welcome to take part in that because that's very much community-based project recording the traditional uses of plants in UK. The initial aim was to collect the uses of plants prior to 1948. The significance of that being National Health Service coming in. And there was a big change when the National Health Service came in. People slightly moved away from traditional plants to kind of your antibiotics from penicillin, etc. Now the other aspect is we managed to get some funding at Kew to evaluate the biological activities, the medicinal properties of some of the UK plants. So it's something we hadn't done before. So we had these 2 projects. One is a plant law project, collecting information about the use, and then the other was more a scientific use. And we started to work with some of the herbalists in UK about, which plants should we look at. And Gabriel Hatfield was one of the herbalists that was very interested in seeing if we could understand the scientific rationale for some of the plants. And she suggested that we work on cleavers, Galium, because she was using it for treating wounds. So fine, thank you. Go to Kew, we actually could find some Galium, even though it's supposed to be a weed-free, so to speak, garden. Found some and made some extracts, got some tests. We'd done other work on kind of wound healing, so we had a nice system in the lab in collaboration with King's College to be able to do the testing. Nothing. Okay, got back to Gabriel, doesn't actually work. You must be doing something else. So she kind of said, well, what did you do? I said, we collected the plants. We dried it, as we normally do. We made an ethanol extract. We took that to dryness, and then we took it up, and we started the tests. And she was kind of saying, that's not how I use it. What I do is I gather it, and usually I gather it in the spring. I don't use it so much later on in the year. Interesting. We'd actually study material in kind of autumn times, right? The other thing that she does is that she uses it fresh as a poultice, replaced every 2 days. So what we did this time is we got material in the springtime. We freeze-dried that material. By that process, we stopped the breakdown of the compounds. So it'd be more like having a fresh material. We made an extract, we tested it, and we got activity. So just illustrating the importance of actually understanding how plants are used. When are they collected? What time of the year? There's other examples we could illustrate. For example, something like the ajugas change between after flowering, before and after flowering. They're medicinal. If you really go back in time, people knew that the medicinal properties would change. But sometimes we've lost that. So I think it's really important to gather the information, have a better understanding and respect for those traditional uses of plants as we try and understand them. Because in this day in society, it's very different from when plants were used traditionally. So of course, when plants were used as the main form of medicines, people weren't taking westernized drugs. They weren't on warfarins, they weren't on statins, they weren't taking other prescribed drugs. And if you get a medicinal plant that really does work in combination then with something else that you're taking, that's when we can sometimes have adverse responses. So I think what we need to do going forward is this real respect for medicinal plants, how they work, but also this dialogue that patients actually need to take. Not only the herbalist, what they tell the herbalist what other drugs that they're taking, but their doctor about the herbs they're taking. The problem is, as I said earlier on, often the doctors don't know enough about the plants to be able to give you an informed opinion about some interaction that might happen. So it's a very difficult kind of situation. But it's really great to have somewhere like this where you can learn more about the plants and other similar projects that are going on, because it's clear that there is a growing interest in medicinal plants and understanding them and making sure that we are growing appropriate plants for the soil, etc., and kind of companion plants so they're actually working well together. And if some of you have some time on the internet, I would suggest you look at quite an inspirational program that's going on, Cities Alive it's called, and it's with Arup. Arup are an engineering consultancy company, and you might say, why am I suggesting you look at something with them? It's because they're trying to capture nature in the development of cities for the future and really have something that works and supports biodiversity, so you don't get concrete jungles, and having biodiversity that relates to the community and adds something to them. So I hope that gives you a bit of an overview of what we're doing. I'm quite willing to take questions.